Hello and welcome to the official YouTube channel of Triune Biblical University Global Extension, USA, where innovation meets education, and learning knows no boundaries. Whether you're a prospective student, a curious learner, or a proud member of our growing global family, we're thrilled to have you here. To our amazing subscribers, thank you so much for your continued support. Your likes, comments, and shares help us reach more learners and inspire more minds every single day. And if you're new here, welcome aboard. Don't forget to hit that subscribe button and tap the notification bell so you never miss out on our latest lectures, updates, expert insights, campus news, and educational content designed just for you. Now, let's dive into today's topic, one you won't want to miss. Today's topic is advanced developmental psychology. Sit back, relax, and enjoy. Class 17 Lecture, Aging and Social Relationships, Family, Friends, and Community. Introduction. Welcome to Class 17 of Advanced Developmental Psychology. In today's lecture, we will focus on the importance of social relationships in late adulthood, examining how family dynamics, friendships, and community involvement contribute to the well-being of older adults. As we have seen in previous classes, aging is not only a time of physical and cognitive change, but it is also deeply influenced by social interactions and relationships. Maintaining strong, supportive connections throughout the later stages of life is critical for emotional and psychological health. In this lecture, we will address the following topics. 1. Family dynamics in late adulthood. The role of family members, particularly adult children, in the lives of older adults. Intergenerational relationships and caregiving. 2. Friendships and social networks. The significance of friendships in late adulthood. How older adults maintain or develop friendships and social networks. The consequences of social isolation. 3. Community involvement and support systems. The role of community centers, volunteering, and civic participation in maintaining mental health. Support groups and formal social services for older adults. By the end of this lecture, you should have a deeper understanding of how social relationships impact aging and the strategies that can be employed to enhance social support systems for older adults. 1. Family dynamics in late adulthood. The family continues to play a central role in the lives of older adults, and family relationships can have both positive and negative impacts on their well-being. As individuals age, family members often become more involved in caregiving, financial support, and emotional guidance. The role of adult children. For many older adults, their adult children are a primary source of emotional support, caregiving, and companionship. The dynamic between older adults and their children changes over time, especially as parents become more dependent on their children for assistance. Caregiving. Adult children often take on the role of caregivers as their parents experience physical or cognitive decline. This can involve helping with daily activities, coordinating medical care, and offering emotional support. Caregiver burden is a common issue for adult children, as caregiving can be physically and emotionally taxing. Emotional support. Adult children may provide emotional comfort, particularly if the older adult is dealing with the loss of a spouse or facing health challenges. Additionally, the presence of adult children can help reduce feelings of loneliness and isolation. Intergenerational relationships. The relationships between older adults and their children often shift as they age. The parent-child relationship, which may have been characterized by dependency in childhood, becomes more egalitarian in adulthood. This change can be challenging for both parties, particularly if the parent is reluctant to accept help. Sibling relationships. In late adulthood, siblings may also become more involved in supporting each other and their aging parents. Sibling relationships can be a source of emotional support, but they can also become strained when disagreements arise regarding caregiving responsibilities or inheritance. Siblings as caregivers. When a parent requires assistance, siblings may need to share the responsibility. This often brings issues such as differing views on caregiving, financial stress, and unequal distribution of labor to the forefront. Conflict and cooperation. The aging process can highlight pre-existing tensions between siblings, but it can also provide an opportunity for reconciliation and increased cooperation. Family therapy or mediation may be helpful in resolving conflicts that arise. 2. Friendships and social networks. Friendships and other social relationships are key components of well-being for older adults. Research consistently shows that older adults with active social networks tend to live longer, experience better physical health, and enjoy higher levels of life satisfaction. The importance of friendships in late adulthood. Friendships continue to be a vital part of social development in later life, providing companionship, emotional support, and opportunities for shared activities. Emotional support. Friends can offer non-judgmental emotional support that can be difficult to find in family relationships. They provide a safe space for older adults to share their fears, anxieties, and joys, without the complications that sometimes arise in family interactions. Shared activities. Older adults often report that having friends with whom they can participate in social activities, e.g., exercise classes, book clubs, travel, etc., enhances their quality of life. These shared activities help to maintain mental and physical health. Social comparison. Friends often engage in social comparison, which can help older adults gauge their own health and functioning in relation to their peers. This comparison can foster motivation and a sense of belonging. Maintaining or developing friendships. As people age, their ability to maintain or develop friendships can be affected by various factors, such as health, mobility, and availability. Social support may need to be actively cultivated in late adulthood. Social media and technology. For older adults, technology can be a powerful tool for staying connected to friends and family. Video calls, social media platforms, and messaging apps can help reduce the barriers posed by physical distance and mobility challenges. Community groups. Joining community organizations or interest-based groups can be an effective way to meet new people and form lasting friendships in later life. These could include religious groups, hobby clubs, or support groups for specific health conditions. See social isolation and loneliness. Loneliness is a significant risk factor for poor mental health and physical health in older adults. Social isolation can result from several factors, including the loss of a spouse, mobility limitations, or a lack of nearby family members. Physical and emotional consequences of isolation. Socially isolated individuals are at higher risk for depression, anxiety, cognitive decline, and physical ailments such as high blood pressure. The experience of loneliness can also increase the risk of death. Interventions. Combating loneliness often requires community-based interventions, including social programs, volunteerism, and accessible transportation services that help older adults remain connected to society. 3. Community involvement and support systems. The role of the broader community is essential in supporting older adults and enhancing their quality of life. Communities can provide valuable resources, from social clubs and recreational activities to formal caregiving services. A role of community centers and social clubs. Community centers, senior centers, and recreational clubs play a pivotal role in maintaining the social health of older adults. Civic engagement. Many older adults continue to engage in volunteer work, advocacy, or other forms of civic participation. This engagement provides a sense of purpose and belonging, which is crucial for mental well-being. Access to resources. Community centers often offer services such as transportation, meals, health screenings, and wellness programs, all of which contribute to the overall health of older individuals. Recreational activities. Community-based recreational programs, such as exercise classes, arts and crafts, or group outings, allow older adults to stay physically active, engage socially, and reduce feelings of isolation. Support services for older adults. Home health care. Many older adults benefit from in-home health care, which can assist with daily living activities and provide medical care. These services help older individuals remain in their own homes and retain some level of independence. Respite care. Caregivers of older adults often require breaks from their responsibilities. Respite care services provide temporary relief to family caregivers, ensuring that both the caregiver and the older adult receive appropriate care and support. Meals on Wheels and other services. Social service organizations, such as Meals on Wheels, provide essential services that deliver food, check in on older adults, and ensure they are not at risk of neglect. The importance of formal caregiving support. As we age, there may be a need for more intensive forms of care, including assisted living, nursing homes, or long-term care facilities. These facilities provide medical, emotional, and physical support for individuals with chronic health conditions or significant disabilities. Nursing homes. These facilities are typically for older adults who require continuous medical care or assistance with daily tasks. Despite the challenges, nursing homes can be an important option for older adults who have no other means of support. In-home care. Some older adults choose to remain at home and receive in-home services. This option allows for more personalized care and may be preferable to institutional settings for those who want to retain their independence. Conclusion. In conclusion, the social relationships that older adults maintain, whether with family, friends, or community members, play an essential role in their overall well-being. Healthy family dynamics, active friendships, and strong community support systems are all factors that help mitigate the negative effects of aging and promote positive aging experiences. By prioritizing social connections and ensuring access to support services, we can enhance the quality of life for older adults and help them navigate the challenges of aging with dignity and support. In our next class, we will explore caregiving in late adulthood, examining both the challenges and rewards of being a caregiver for aging family members and the policies that support caregivers. End of Class 17. Class 18 Lecture: Cognitive Development in Older Adulthood, Memory, Intelligence, and Learning. Introduction. Welcome to Class 18 of Advanced Developmental Psychology. In today's lecture, we will delve into cognitive development in older adulthood, focusing on the key aspects of memory, intelligence, and learning. As we continue our exploration of aging, it's essential to understand the cognitive changes that occur during the later stages of life. While many individuals experience declines in certain cognitive functions, it is also crucial to recognize the variability and plasticity of cognitive aging, as some abilities can remain intact or even improve. We will cover the following topics today. 1. Memory in older adults. Understanding age-related changes in memory, including both declines and preservation. Different types of memory: episodic, semantic, and working memory. Strategies to mitigate memory decline. 2. Intelligence and cognitive abilities in later life. Theories of intelligence and how they apply to older adults. The impact of aging on fluid and crystallized intelligence. The role of education, experience, and lifestyle in preserving cognitive function. 3. Learning in older adulthood. How older adults learn new skills and information. Factors that affect learning abilities in older age. The concept of cognitive reserve and its importance in learning during aging. By the end of this lecture, you should be able to understand how cognitive abilities evolve in late adulthood and the factors that influence the maintenance or decline of these abilities. 1. Memory in older adults. Memory is one of the cognitive functions most often studied in aging research. Older adults may experience age-related changes in memory, but it is important to distinguish between the normal aging process and memory disorders, such as dementia. Types of memory in aging. Episodic memory. This refers to the ability to recall specific events and experiences. Older adults typically experience declines in episodic memory, which is why they may have difficulty remembering recent events or conversations. However, long-term memories, those formed in younger years, tend to be better preserved. Semantic memory. This type of memory involves the recall of general knowledge, facts, and concepts. Unlike episodic memory, semantic memory tends to be more resilient as people age. Older adults often retain a wealth of factual knowledge, even though they may experience difficulty recalling specific events. Working memory. Working memory refers to the capacity to hold and manipulate information in the short term. It involves tasks such as mental arithmetic or remembering a phone number long enough to dial it. Working memory tends to decline with age, making it harder for older adults to process and manage multiple pieces of information simultaneously. Age-related memory changes. Memory changes in later life can vary significantly from person to person. Some individuals experience mild cognitive impairment, MCI, which may involve subtle memory difficulties that are more pronounced than what is considered normal aging, but not severe enough to be classified as dementia. Slower encoding and retrieval. One of the most common age-related changes is a slower speed of processing. Older adults may take longer to encode information into memory, and may have difficulty retrieving it later. This is often referred to as encoding inefficiency. Tip of the tongue phenomenon. Many older adults experience the tip of the tongue phenomenon more frequently when they know something, but cannot quite recall it at the moment. This is more common in older adults than in younger individuals. See mitigating memory decline. While memory loss is often associated with aging, there are several strategies that older adults can use to help preserve or even improve their memory. Cognitive training. Cognitive exercises, such as puzzles, brain games, and memory-enhancing activities, have been shown to improve certain aspects of memory and cognitive functioning in older adults. Engaging in these activities regularly helps maintain mental agility. Healthy lifestyle. Regular physical activity, a nutritious diet, and good sleep hygiene contribute to overall brain health. Exercise, in particular, has been linked to improvements in memory and cognitive function. Social engagement. Maintaining social connections is another important factor. Social interaction helps keep the brain active, reducing the risk of cognitive decline associated with isolation. Mnemonic devices. Using mnemonic techniques, such as visualization, repetition, and chunking, can help older adults remember information more effectively. 2. Intelligence and cognitive abilities in later life. Intelligence in later life is a complex issue, as different aspects of intelligence are affected differently by aging. Theories of intelligence help us understand these differences and why older adults can retain some cognitive abilities while experiencing declines in others. Fluid versus crystallized intelligence. Fluid intelligence. This refers to the ability to reason, solve novel problems, and think abstractly. Fluid intelligence tends to decline with age, especially after middle age. Older adults may find it more difficult to solve new problems or think creatively about unfamiliar tasks. Crystallized intelligence. In contrast to fluid intelligence, crystallized intelligence refers to accumulated knowledge, experience, and skills. This form of intelligence typically remains stable or even increases with age. For example, older adults may have a vast store of knowledge that allows them to perform well in areas such as vocabulary, general knowledge, and decision-making. Cognitive decline versus compensation. While fluid intelligence may decline, older adults often compensate by using their crystallized intelligence. For instance, they may rely on experience and wisdom, rather than rapid problem solving to navigate challenges. B. The role of education and experience. Education and life experience play a significant role in determining the level of intelligence maintained during older adulthood. Lifelong learning and continued mental engagement can help preserve cognitive abilities. For example, higher education. Older adults with higher levels of education may experience less cognitive decline compared to those with lower levels of education. The cognitive demands of academic work can serve as a protective factor. Work and volunteering. Continuing to work or volunteer in intellectually stimulating environments helps maintain cognitive functioning. Engaging in complex tasks at work or through volunteer activities contributes to mental reserve. See cognitive reserve and brain plasticity. Cognitive reserve. This refers to the brain's ability to withstand damage or age-related changes due to the buildup of neural connections and mental resources over time. People with higher cognitive reserve are better able to compensate for cognitive decline. This concept emphasizes the role of mental activity, education, and social engagement in preserving cognitive function. Brain plasticity. The brain's ability to reorganize and form new neural connections is a key factor in cognitive aging. Even as the brain ages, it retains the capacity for plasticity, which allows older adults to learn new information and adapt to new situations. Encouraging learning and mental challenges can help promote this plasticity. 3. Learning in older adulthood. Learning new skills or information becomes increasingly important as people age, both to maintain cognitive function and to adapt to new life circumstances. Understanding how older adults learn is critical to developing effective strategies for educational and intervention programs. Age-related learning challenges. While older adults can continue learning well into later life, certain factors may make learning more challenging. Slower processing speed. As discussed earlier, the speed of processing information tends to slow down in older adulthood. This means that older learners may need more time to process new information. Declines in working memory. With a decline in working memory, older adults may have difficulty holding onto and manipulating multiple pieces of information at once, which can complicate the learning of new tasks. Reduced motivation. Some older adults may feel less motivated to engage in new learning due to a perceived lack of need or the discomfort of unfamiliar tasks. B. Strategies to facilitate learning in older adults. Use of familiar contexts. Presenting new information in contexts that are familiar to older adults, such as drawing upon their prior knowledge or experiences, can make learning more effective. Repetition and practice. Older adults often benefit from repetition and structured practice to solidify learning. Repeating tasks and allowing ample time for mastery can aid retention. Multisensory learning. Engaging multiple senses in the learning process, e.g., visual, auditory, tactile, can enhance memory and understanding. See lifelong learning and educational programs. Lifelong learning opportunities are crucial for promoting cognitive health in older adulthood. Programs designed for older adults, such as community college classes, hobby groups, or online courses, provide cognitive stimulation and social interaction, both of which contribute to positive aging. Conclusion. Cognitive development in older adulthood is multifaceted, involving changes in memory, intelligence, and learning. While some cognitive functions, such as working memory and fluid intelligence, may decline with age, other aspects, such as crystallized intelligence and long-term memory, often remain intact or even improve. The concept of cognitive reserve highlights the importance of continued learning and mental engagement throughout life in preserving cognitive abilities. As we age, it is essential to adopt strategies that support memory and learning, such as engaging in stimulating activities, maintaining physical health, and cultivating social connections. By doing so, older adults can continue to lead mentally active and fulfilling lives. In our next class, we will explore the psychosocial aspects of aging, focusing on the concepts of life satisfaction, identity in later life, and successful aging. End of Class 18. Class 19 Lecture. Emotional Development in Later Life, Coping, Well-Being, and Adjustment. Introduction. Welcome to Class 19 of Advanced Developmental Psychology. Today's lecture will focus on emotional development in later life, a key aspect of successful aging. While much of the developmental literature on older adulthood has emphasized cognitive changes, emotional development is equally critical for understanding how individuals adjust to the challenges of aging. As people move through later stages of life, they continue to experience a wide range of emotions, from joy and contentment to sadness and loss. However, how older adults cope with these emotions and adapt to aging-related changes varies significantly across individuals. In this lecture, we will discuss the following topics. 1. Emotional regulation in older adults. How older adults manage and express their emotions. 2. Well-being and life satisfaction. What contributes to emotional well-being in later life. 3. Coping mechanisms. The strategies older adults use to deal with stress, loss, and change. 4. Adjustment to aging. How older adults navigate the challenges associated with aging, including health problems, retirement, and loss of loved ones. By the end of this lecture, you should have a clearer understanding of how emotional development continues throughout later life and the various factors that contribute to emotional well-being in old age. 1. Emotional regulation in older adults. Emotional regulation refers to the processes by which individuals influence their emotions when they experience them and how they express them. Emotional regulation in older adulthood can be influenced by various factors, including life experience, social support, and cognitive functioning. A. Decreased negative emotions with age. Interestingly, research has shown that negative emotions, e.g., anger, anxiety, sadness, tend to decrease as people age. Older adults report fewer instances of negative emotional experiences than younger adults. Several theories explain this phenomenon. Socio-emotional selectivity theory, Carstensen, 1992. This theory suggests that as individuals age, they prioritize emotionally meaningful relationships and experiences, focusing more on positive emotions, and minimizing exposure to negative emotional stimuli. Older adults often spend more time with close family and friends, engage in activities they enjoy, and focus on the present, rather than future uncertainties. Emotional selectivity. As time horizons shorten, older adults are more motivated to cultivate positive experiences and limit the impact of negative emotions. This may involve engaging in less conflict, focusing on positive memories, or disengaging from stressors that are no longer relevant. Cognitive changes. Cognitive decline in later life, while often associated with certain difficulties, may have an unexpected emotional benefit. Emotional filtering. Older adults may have less concern with external, negative factors, such as societal pressures or financial stress, and more ability to focus on emotional contentment and positivity. Emotional positivity and aging. Older adults generally report greater emotional positivity and contentment. Despite the challenges of aging such as physical decline, retirement, or loss of loved ones, many older adults exhibit a greater capacity for positive emotions. This is often attributed to the mature emotional regulation skills they have developed over a lifetime. These skills allow for better emotion regulation. Older adults are more likely to use adaptive strategies, e.g., reframing, acceptance, to regulate emotions in response to stress or negative life events. Decreased emotional reactivity. Emotional responses to stressors tend to be less intense in older adulthood. Older adults may experience greater emotional stability and less emotional volatility than younger individuals. Greater emotional wisdom. Life experience contributes to a more balanced emotional outlook. Older adults are often able to handle challenging emotions more effectively, draw from past coping strategies, and maintain emotional equilibrium despite difficulties. 2. Well-being and life satisfaction in later life. Well-being and life satisfaction are key components of emotional development. Older adults' well-being is shaped by numerous factors, including health, social relationships, economic stability, and psychological factors, such as self-esteem and perceived control. Determinants of well-being in later life. Health and physical functioning. Physical health is one of the most important determinants of well-being. Chronic illness, disability, or functional decline can significantly impact an individual's quality of life and emotional state. Conversely, good physical health can lead to higher life satisfaction. Social support. Having strong social support networks, family, friends, or community can enhance emotional well-being. Older adults who maintain close social relationships tend to report higher levels of happiness and are less likely to experience depression or isolation. Economic stability. Financial security plays a crucial role in emotional well-being. Retirement, pension income, and financial planning affect older adults' stress levels and their ability to maintain a sense of independence. Older adults who struggle financially may experience increased anxiety, reduced satisfaction, and even depression. Perceived control. Research indicates that older adults who feel in control of their lives, including their health and environment, tend to report better emotional well-being. This sense of control is linked to a greater sense of autonomy, self-efficacy, and optimism. Self-esteem and identity. Older adults with a positive sense of self-worth and a strong sense of identity, based on past achievements, family roles, or personal goals, report higher levels of life satisfaction. Aging can bring a sense of accomplishment and acceptance that boosts overall well-being. The paradox of aging. Greater satisfaction despite declining health. A well-established finding in gerontology is the paradox of aging. Older adults, despite facing physical and health challenges, often report high levels of life satisfaction. This phenomenon can be explained by several factors. Perspective shift. Older adults often view life through a lens of acceptance and gratitude, making them more appreciative of the present moment. Emotional regulation. As discussed earlier, older adults are better at managing negative emotions and tend to focus on positive experiences, contributing to a higher sense of well-being. Adaptation to loss. While aging inevitably involves loss of physical abilities, loved ones, or roles in society, older adults often adapt to these losses more effectively, leading to higher satisfaction despite such challenges. 3. Coping mechanisms in later life. Older adults are often faced with a unique set of stressors and challenges, including health problems, loss of independence, the death of loved ones, and adjustments to retirement. How they cope with these stressors significantly affects their emotional well-being. A common coping strategies in older adulthood. Problem-focused coping. This type of coping involves taking direct action to address a problem or stressor. Older adults who engage in problem-focused coping tend to make active changes in their environment to resolve issues, such as seeking medical advice, modifying their lifestyle, or organizing their financial situation. Emotion-focused coping. Older adults are more likely to use emotion-focused coping when direct problem solving is not possible. This involves managing the emotional distress caused by a situation, such as through acceptance, reframing, or emotional distancing. For example, an older adult may accept the limitations caused by a chronic illness and focus on enjoying their current quality of life rather than focusing on what they have lost. Meaning-based coping. Some older adults cope with adversity by finding meaning in their life experiences. This could include drawing on religious or spiritual beliefs, finding a sense of purpose in volunteer work or family relationships, or reflecting on the value of life's journey. Meaning-based coping can provide psychological resilience and help older adults make sense of loss. B. Social support as a coping resource. Social support plays a crucial role in how older adults cope with stress. Research indicates that older adults who have strong social networks are better equipped to handle emotional challenges. Support from family, friends, and community members offers emotional comfort, practical assistance, and a sense of belonging. See resilience and adaptation. Older adults tend to demonstrate a remarkable degree of resilience, the ability to recover from setbacks, adapt to adversity, and maintain well-being despite challenges. Resilience can be fostered by maintaining a positive outlook on life, engaging in regular social activities, pursuing hobbies and interests that bring joy and fulfillment, seeking professional help for mental health challenges. 4. Adjustment to aging, life transitions and challenges. The process of aging brings a series of life transitions, each of which requires adjustment. These include retirement, changes in physical health, loss of loved ones, and changing roles in society. A. Retirement and loss of role identity. Retirement is a major life transition for older adults, often resulting in a loss of role identity, especially if work was central to their sense of purpose. How well an individual adjusts to retirement depends on several factors. Preparation for retirement. Older adults who prepare for retirement, both financially and emotionally, tend to adjust more smoothly. Subsequent engagement. Staying active through part-time work, volunteering, or hobbies can help maintain a sense of purpose and identity in retirement. B. Coping with loss. Aging often brings the loss of loved ones, which can result in grief and emotional distress. Coping with loss is an ongoing process, and older adults may rely on social support, therapy, and meaning-making to help them navigate grief. Conclusion. Emotional development in later life is shaped by a range of factors, from personal coping strategies to social relationships and life transitions. Older adults often report greater emotional stability and life satisfaction, despite facing physical and emotional challenges. Their ability to regulate emotions, draw on past experiences, and find meaning in life plays a key role in maintaining emotional well-being. In addition, coping strategies such as problem-focused coping, emotion-focused coping, and meaning-based coping help older adults manage stress and adapt to the challenges of aging. In the next class, we will explore aging and social relationships, focusing on family dynamics, friendships, and the role of social networks in promoting healthy aging. End of Class 19. Class 20 Lecture, Aging and Social Relationships, Family, Friendships, and Social Networks. Introduction. Welcome to Class 20 of Advanced Developmental Psychology. Today, we will explore the profound role of social relationships in later life, a topic that is critical to understanding the aging process and its emotional and psychological impacts. As individuals age, their social networks, family dynamics, and friendships evolve, with significant consequences for mental health, well-being, and life satisfaction. Research consistently shows that older adults with strong social connections report better overall health, higher life satisfaction, and lower rates of depression and loneliness. As people enter older adulthood, the quality and quantity of their social relationships may change, but the need for social interaction and meaningful connections remains just as important as in earlier stages of life. In this lecture, we will cover the following topics. 1. The role of family in later life. How family relationships impact aging and emotional development. 2. Friendships in later life. The importance of peer relationships as people age. 3. Social networks and loneliness. The effects of social isolation and the importance of maintaining diverse social networks. 4. Intergenerational relationships. The benefits of relationships across generations, including grandparent-grandchild bonds and caregiving dynamics. By the end of this class, you will have a deeper understanding of how aging impacts social relationships, how these relationships affect well-being, and how older adults can maintain or build meaningful social connections. 1. The role of family in later life. Family is often the cornerstone of an older adult's social support network, providing emotional, physical, and financial support during the aging process. The family is typically the primary source of caregiving when health problems arise, and the dynamics within families can influence emotional well-being significantly. Changing family roles. As individuals age, their roles within the family often shift. These changes can have both positive and negative effects on older adults' emotional and psychological well-being. Common changes include empty nest syndrome. When children leave the home, older adults may experience feelings of loss or a diminished sense of purpose. However, some parents embrace this stage as an opportunity for renewed focus on personal goals or their relationship with their spouse. Grandparenting. Many older adults take on the important role of grandparents. This relationship can be a source of joy and meaning, as it often provides an opportunity to engage in nurturing and supportive roles, without the full-time responsibilities of parenting. Caregiving. Older adults may find themselves becoming caregivers for spouses, aging parents, or other relatives. These caregiving responsibilities can be emotionally demanding, but can also provide a sense of purpose and connection. However, caregiver burnout is a real risk, and support is critical. B. The impact of family on well-being. Family relationships are crucial for emotional well-being in older adulthood. Positive family relationships are associated with better mental health. Older adults with strong family ties tend to experience lower levels of depression and anxiety. Greater life satisfaction. Close, supportive relationships contribute significantly to happiness and overall life satisfaction in later life. Physical health benefits. Emotional support from family members can lower stress and improve physical health outcomes by promoting healthier behaviors and providing caregiving assistance during illness. However, strained family relationships, whether due to unresolved conflicts, distance, or caregiving stress, can lead to negative outcomes, such as increased stress, depression, and isolation. 2. Friendships in later life. Friendships remain important throughout the lifespan, but their role becomes particularly prominent in later life, when individuals may experience a reduction in family-based support. Friendships often provide an emotional outlet, opportunities for companionship, and a sense of belonging that is vital for emotional well-being. The importance of friendships in aging. Emotional support. Friends provide an essential emotional support network, offering understanding and companionship that can mitigate feelings of loneliness and isolation. Shared activities. Friendships in later life often revolve around shared activities such as hobbies, volunteering, or group activities. These interactions promote mental and physical well-being by providing opportunities for social engagement and physical activity. Social integration. Friendships help older adults stay connected to the community and remain socially engaged. This engagement is essential for mental health and reducing the risk of depression. Friendship dynamics in older adulthood. Friendships in later life tend to be characterized by fewer but more meaningful relationships. As people age, they often prioritize quality over quantity in their friendships. They tend to cultivate deeper, more meaningful relationships with a smaller circle of friends. Gender differences. Research indicates that women tend to have larger, more emotionally supportive social networks than men. They are also more likely to maintain close friendships in later life, while men may experience greater social isolation if they lack strong friendships. Loss of friends. Aging often comes with the loss of friends due to health issues, death, or relocation. While some older adults may find it difficult to replace lost friends, others may form new friendships, particularly through community or senior groups. 3. Social networks and loneliness. Social networks, defined as the web of relationships and interactions an individual maintains, are crucial for well-being in later life. Loneliness, often a byproduct of limited social interaction or isolation, is a serious concern among older adults, with significant implications for mental and physical health. The problem of social isolation. Social isolation is defined as the absence of meaningful social relationships. It differs from loneliness, which refers to the subjective feeling of not having sufficient social connections. Social isolation can result from physical disabilities, relocation, loss of a spouse or friends, or limited mobility. Consequences of isolation. Prolonged social isolation has been linked to a range of negative outcomes, including depression, anxiety, cognitive decline, and even physical health problems, such as increased risk of cardiovascular disease. Health risks. Isolated older adults may experience poor sleep quality, higher levels of stress, and a reduced immune response. They may also be at greater risk for developing chronic conditions, due to lack of support for healthy behaviors and self-care. Combating loneliness and isolation. Maintaining and expanding social networks can prevent or mitigate feelings of loneliness and isolation. Strategies include community engagement. Older adults who remain active in their communities through volunteering, attending church, or participating in group activities tend to have more robust social networks and report higher levels of happiness and life satisfaction. Technological tools. The use of technology, e.g., video calls, social media, can help older adults maintain long-distance relationships, especially in the face of mobility challenges or living alone. Support groups. Joining support groups for specific life challenges, e.g., widowhood, chronic illness, can provide emotional connection and a sense of shared understanding. 4. Intergenerational relationships. Intergenerational relationships, or those between older adults and younger generations, e.g., children, grandchildren, and even great-grandchildren, are of particular significance in later life. These relationships provide emotional fulfillment, a sense of continuity, and opportunities for personal growth. The role of grandparents. Grandparents often play a vital role in family dynamics, providing love, guidance, and support to grandchildren. Research shows that grandparents often report higher levels of happiness and satisfaction when they have close relationships with their grandchildren. Transmission of wisdom. Grandparents may pass down knowledge, traditions, and life experiences, which contributes to both their sense of identity and the emotional well-being of younger generations. Emotional support. In addition to their role as caregivers and role models, grandparents can provide emotional stability to grandchildren, especially during times of family crisis or transition. Caregiving across generations. As older adults experience health problems, they may become dependent on their adult children or other family members for caregiving. The caregiving relationship can be both rewarding and stressful, requiring adjustments from both parties. Caregiver stress. Adult children or family members who take on caregiving roles often face significant challenges, including emotional strain, financial burdens, and physical exhaustion. However, some individuals find that caregiving deepens their relationship with the elderly family member and brings a sense of fulfillment. Reciprocity in relationships. The cycle of caregiving where younger generations provide support for older generations can strengthen family bonds. However, it's crucial for families to maintain open communication and share caregiving responsibilities to avoid caregiver burnout. Conclusion. Social relationships in older adulthood are a fundamental aspect of emotional development and well-being. Family relationships, friendships, and social networks provide essential emotional support, contribute to life satisfaction, and help older adults cope with the challenges of aging. Moreover, intergenerational relationships, whether through grandparenting or caregiving, can enrich the lives of both older adults and younger generations. In the next class, we will discuss aging and cognitive health, focusing on how cognitive abilities change in later life, and the strategies for maintaining cognitive function as we age. End of Class 20. Class 21 Lecture, Aging and Cognitive Health, Memory, Attention, and Executive Functioning. Introduction. Welcome to Class 21 of Advanced Developmental Psychology. Today, we turn our focus to the relationship between aging and cognitive health, an essential topic, in understanding how our cognitive abilities change over the lifespan, particularly in late adulthood. As individuals age, there are often noticeable changes in cognitive functioning, such as declines in memory, attention, and executive functioning. However, it's important to note that cognitive aging is not a uniform process. Some individuals maintain high levels of cognitive function into their later years, while others experience more significant challenges. In this lecture, we will 1. Examine the impact of aging on various cognitive domains, focusing on memory, attention, and executive functioning. 2. Explore the mechanisms behind cognitive decline and how these changes relate to the brain's aging process. 3. Discuss strategies for maintaining cognitive health, including physical activity, mental stimulation, and lifestyle factors. 4. Review the distinction between normal aging and pathological decline, such as dementia and Alzheimer's disease. By the end of this class, you will have a deeper understanding of how aging influences cognitive functions, and you will also be equipped with strategies to help preserve cognitive health in later life. 1. Memory and aging. Memory is one of the most commonly affected cognitive functions in older adults. It is important to understand that not all forms of memory are equally impacted by aging. Some types of memory remain relatively stable, while others are more susceptible to age-related decline. A types of memory affected by aging. Working memory. This is the cognitive system responsible for holding and manipulating information over short periods. Working memory tends to show a decline with age, particularly in tasks that require multitasking or holding multiple pieces of information in mind simultaneously. This decline is often due to changes in the prefrontal cortex, which is involved in managing cognitive resources. Episodic memory. Episodic memory refers to the ability to recall specific events or experiences. Aging is often associated with difficulty in remembering events and experiences, especially those that happened recently. This decline may be linked to changes in the hippocampus, a region of the brain involved in forming new memories. Semantic memory. Unlike episodic memory, semantic memory involves recalling facts and general knowledge, e.g., knowing that Paris is the capital of France. Research suggests that semantic memory remains relatively intact in older adults, even as other forms of memory decline. Prospective memory. This type of memory refers to remembering to perform an action in the future, e.g., remembering to take medication. Older adults may experience difficulties with prospective memory, especially when tasks are complex or require a high level of organization. B. Factors influencing memory decline. Several factors can contribute to memory decline as we age, including biological changes, structural and functional changes in the brain, particularly in areas such as the hippocampus and prefrontal cortex, contribute to memory decline. Neurotransmitter systems, such as acetylcholine, which are critical for memory formation, also show changes with aging. Health conditions. Conditions like hypertension, diabetes, and sleep disorders can exacerbate memory problems. Additionally, certain medications can interfere with memory functioning. Lifestyle factors. Lack of physical activity, poor nutrition, and social isolation can also accelerate memory decline. On the other hand, engaging in mentally stimulating activities and maintaining social connections can help preserve cognitive function. 2. Attention and aging. Attention, which involves focusing mental resources on a specific task or stimulus, is another cognitive function that can change with age. Attention is a broad cognitive domain, encompassing sustained attention, selective attention, and divided attention. A. Types of attention affected by aging. Sustained attention. This is the ability to maintain focus on a single task over time. Research suggests that older adults may experience difficulty maintaining sustained attention, especially for long, monotonous tasks. However, this can be mitigated by providing more engaging or stimulating tasks. Selective attention. Selective attention refers to the ability to focus on a particular stimulus while ignoring irrelevant information. Older adults may struggle more with filtering out distractions, which can lead to slower reaction times, and difficulty concentrating in busy or distracting environments. Divided attention. Divided attention refers to the ability to manage multiple tasks simultaneously. Older adults often experience difficulty with multitasking. While younger individuals can switch between tasks rapidly, older adults tend to experience a greater decline in their ability to juggle multiple tasks at once. B. The cognitive mechanisms behind attention decline. As individuals age, there are changes in the dopaminergic system. Dopamine is crucial for attention and motivation, and the prefrontal cortex, which is involved in regulating attention, becomes less efficient. These changes contribute to slower processing speeds and decreased flexibility in managing attention. 3. Executive functioning and aging. Executive functions are a set of high-level cognitive processes that allow us to plan, make decisions, solve problems, and control our impulses. These functions are crucial for goal-directed behavior, and they tend to decline with age. Key aspects of executive functioning affected by aging. Inhibition. This refers to the ability to suppress irrelevant or inappropriate responses. Older adults often find it harder to inhibit automatic responses, which can lead to impulsivity or difficulties in controlling emotions or behaviors. Cognitive flexibility. Cognitive flexibility is the ability to adapt to new or changing situations. Aging is associated with a decline in cognitive flexibility, which may make it harder for older adults to shift between tasks or adapt to new information. Planning and decision-making. Aging may also affect the ability to plan complex tasks and make decisions, particularly in situations that require a high degree of abstract thinking. Older adults may struggle to plan ahead effectively, especially if the tasks are unfamiliar or require multitasking. Brain changes and executive functioning. The decline in executive functioning is primarily attributed to structural changes in the prefrontal cortex, which becomes less efficient with age. Additionally, changes in white matter, the brain's communication pathways, can impair the ability to process information quickly and effectively, which impacts executive functions like decision-making and problem-solving. 4. Maintaining cognitive health. While some cognitive decline is a normal part of aging, research suggests that there are effective strategies for maintaining and even enhancing cognitive function in later life. Physical activity. Regular physical activity, particularly aerobic exercise, has been shown to support cognitive health. Exercise increases blood flow to the brain, promotes neurogenesis, the creation of new neurons, and supports the health of the hippocampus. Engaging in regular exercise can reduce the risk of cognitive decline and improve memory, attention, and executive functioning. Mental stimulation. Engaging in mentally stimulating activities such as reading, playing musical instruments, doing puzzles, or learning new skills can help keep the brain active. Studies suggest that intellectual engagement can create cognitive reserve, which helps protect against the effects of aging on the brain. Social engagement. Maintaining social connections is also vital for cognitive health. Social engagement provides mental stimulation, emotional support, and opportunities for meaningful interaction, all of which contribute to better cognitive function in later life. Healthy lifestyle choices. Other lifestyle factors such as adequate sleep, healthy nutrition, stress management, and avoiding smoking or excessive alcohol consumption are crucial for preserving cognitive health. A balanced diet rich in fruits, vegetables, and healthy fats, such as omega-3 fatty acids, has been associated with better brain health. 5. Normal aging versus pathological cognitive decline. It's important to differentiate between normal cognitive aging and pathological decline, such as dementia or Alzheimer's disease. Normal aging. In normal aging, cognitive decline is typically gradual and may involve mild changes in memory, attention, and executive function. These changes do not significantly impair daily functioning. Pathological decline. Conditions like Alzheimer's disease or vascular dementia involve more severe cognitive impairments that interfere with daily life. Symptoms include profound memory loss, difficulty with communication, disorientation, and impairments in judgment and problem solving. Diagnosis of these conditions is based on comprehensive assessments, including neuropsychological tests, brain imaging, and medical history. Early intervention and lifestyle changes can help manage symptoms and improve quality of life. Conclusion. Cognitive aging is a complex process that involves changes in memory, attention, and executive function. While these changes are a normal part of growing older, there are several strategies such as physical activity, mental stimulation, and social engagement that can help maintain cognitive health and slow down decline. Understanding the distinction between normal aging and pathological conditions is also crucial for supporting older adults in maintaining their independence and quality of life. In our next class, we will dive deeper into age-related cognitive disorders, specifically focusing on Alzheimer's disease, Parkinson's disease, and other forms of dementia. We will discuss their symptoms, causes, and current treatments. End of Class 21. Class 22 Lecture: Age-Related Cognitive Disorders, Alzheimer's disease, Parkinson's disease, and dementia. Introduction. Welcome to Class 22 of Advanced Developmental Psychology. In this lecture, we will focus on age-related cognitive disorders, specifically Alzheimer's disease, Parkinson's disease, and dementia. These conditions are among the most significant causes of cognitive decline in older adults, and understanding them is essential for anyone involved in the care, treatment, or study of aging populations. We will explore 1. The characteristics and symptoms of Alzheimer's disease, Parkinson's disease, and other forms of dementia. 2. The underlying biological and neurological mechanisms that contribute to these disorders. 3. Current diagnostic criteria and tools used to identify these conditions. 4. Treatment options and approaches for managing and slowing the progression of cognitive decline. 5. The psychological and emotional impacts of these disorders on patients and their families. By the end of this lecture, you should have a comprehensive understanding of the most common age-related cognitive disorders, and be equipped with knowledge on how to approach these complex conditions from both a clinical and caregiving perspective. 1. Alzheimer's disease, AD. Overview. Alzheimer's disease is the most common form of dementia, accounting for approximately 60 to 80% of dementia cases. It is a progressive neurological disorder that primarily affects memory, thinking, and behavior. Prevalence. Alzheimer's disease predominantly affects individuals aged 65 and older, though early onset Alzheimer's can occur before the age of 65. Symptoms. The hallmark symptoms of Alzheimer's disease include severe memory loss, confusion, difficulty with language, disorientation, and mood changes. Over time, individuals may lose the ability to recognize loved ones, perform basic tasks, or care for themselves. B. Neurological mechanisms. The primary cause of Alzheimer's disease is the accumulation of amyloid plaques and tau tangles in the brain. These abnormal protein deposits interfere with the functioning of neurons and disrupt communication between brain cells. Amyloid plaques. Amyloid beta protein fragments clump together to form plaques that accumulate between neurons and disrupt synaptic function. Tau tangles. Tau protein, which normally helps stabilize microtubules in neurons, becomes abnormally phosphorylated and forms tangles inside the cells, impairing their function. As a result, there is a significant reduction in the size of the hippocampus, a critical area for memory, and other brain regions involved in cognitive functions. See symptoms progression. Early stage symptoms: short-term memory loss, forgetfulness, difficulty recalling names and appointments, and challenges in learning new information. Middle stage symptoms: increased memory loss, difficulty in recognizing family members, confusion regarding time and place, and frequent mood swings. Late stage symptoms: loss of speech, loss of mobility, and inability to recognize family members or surroundings. Individuals may require full-time care. Diagnosis and treatment. Diagnosis. Diagnosis is typically based on clinical evaluations, neuroimaging, e.g., MRI or PET scans, and neuropsychological tests. There is no definitive test for Alzheimer's, but biomarkers like amyloid beta and tau in cerebrospinal fluid may aid in diagnosis. Treatment. While there is no cure for Alzheimer's, certain medications can temporarily reduce symptoms or slow disease progression. Cholinesterase inhibitors, e.g., donepezil, are commonly prescribed to improve communication between nerve cells. Other treatments focus on managing symptoms such as agitation, depression, and sleep disturbances. 2. Parkinson's disease, PD. Overview. Parkinson's disease is a progressive neurodegenerative disorder primarily characterized by motor symptoms, but can also lead to cognitive decline, including dementia. Prevalence: Parkinson's disease affects about 1% of people over the age of 60. It is more common in men than women. Symptoms: Parkinson's disease presents with motor symptoms such as tremors, rigidity, bradykinesia, slowness of movement, and postural instability. As the disease progresses, individuals may develop cognitive impairments, including memory problems and executive dysfunction. Neurological mechanisms: Parkinson's disease is caused by the degeneration of dopaminergic neurons in the substantia nigra, a part of the brain involved in movement control. Dopamine is a neurotransmitter that facilitates smooth and coordinated muscle movements. Dopamine deficiency: As dopamine-producing neurons die, the brain's ability to coordinate movement diminishes, leading to the motor symptoms seen in PD. Cognitive and mood symptoms often emerge later, as the disease spreads to other areas of the brain. See symptoms and cognitive decline. Motor symptoms: tremors, muscle stiffness, slowness of movement, and problems with balance and coordination. Cognitive symptoms: In later stages, Parkinson's disease can lead to cognitive impairment, including difficulty with attention, planning, memory, and decision-making. Parkinson's disease dementia (PDD) is a subtype of dementia that occurs in up to 50% of individuals with Parkinson's disease. Diagnosis and treatment. Diagnosis: Parkinson's disease is primarily diagnosed based on clinical symptoms, neurological examination, and response to medication. Neuroimaging may be used to rule out other causes of symptoms. Treatment: The primary treatment for Parkinson's disease is the use of dopamine replacement therapy, such as levodopa, which can alleviate motor symptoms. Other medications may help with specific symptoms, such as dopamine agonists and MAO-B inhibitors. Cognitive and psychiatric symptoms may be managed with medications, including antidepressants and antipsychotics. 3. Dementia. Overview. Dementia is an umbrella term for a range of cognitive impairments that interfere with daily functioning, including memory, attention, language, and problem-solving abilities. Alzheimer's disease is the most common form of dementia, but other types include vascular dementia, frontotemporal dementia, and Lewy body dementia. Vascular dementia. Overview. Vascular dementia is caused by reduced blood flow to the brain, leading to the death of brain cells. It often occurs after a stroke or series of mini-strokes, which damage brain tissue. Symptoms. Cognitive symptoms include difficulties with memory, reasoning, and attention. Symptoms often appear suddenly or progress in a step-like manner. See frontotemporal dementia, FTD. Overview. FTD is a rare form of dementia that primarily affects the frontal and temporal lobes of the brain. It often begins in individuals between 40 and 65 years old. Symptoms. FTD is characterized by significant personality changes, impulsive behavior, and language difficulties. Unlike Alzheimer's disease, memory impairment is not typically the first symptom. Lewy body dementia, LBD. Overview. LBD is characterized by abnormal protein deposits called Lewy bodies that accumulate in brain cells, impairing cognitive function. Symptoms. LBD presents with a combination of cognitive decline, motor symptoms similar to Parkinson's disease, and visual hallucinations. It is often misdiagnosed as Parkinson's disease dementia or Alzheimer's. 4. Psychological and emotional impacts. The diagnosis of age-related cognitive disorders like Alzheimer's disease and Parkinson's disease has profound psychological and emotional effects, both on the individual and their family members. Psychological effects on patients. Patients may experience anxiety, depression, and feelings of loss of autonomy, as they realize their cognitive abilities are declining. The loss of independence and the ability to recognize loved ones can lead to profound emotional distress. Caregiver burden. Family members and caregivers often experience significant emotional strain. The responsibilities of caregiving can lead to burnout, stress, and even depression among caregivers, particularly when managing the complexities of progressive diseases. 5. Current and future directions in treatment. While there is currently no cure for most age-related cognitive disorders, research into treatments and potential cures continues to advance. Gene therapy. Investigating gene therapies to slow down or reverse the effects of neurodegenerative diseases is an exciting area of research. Stem cell therapy. Stem cell-based approaches aim to replace damaged neurons and restore lost brain function. Though much of this work is still in the experimental stage, cognitive training, cognitive interventions and training programs aim to improve specific cognitive skills, such as memory and attention, and may help slow cognitive decline in early stages of dementia. Conclusion: age-related cognitive disorders like Alzheimer's disease, Parkinson's disease, and other forms of dementia are complex and devastating conditions that affect millions of individuals worldwide. While there are no cures for these disorders, advancements in early diagnosis, treatment, and care strategies provide hope for improving the quality of life for affected individuals and their families. A better understanding of the biological mechanisms, symptoms, and available treatments will help in both clinical and caregiving contexts, ensuring that those affected can receive appropriate support and intervention. In our next class, we will explore the psychological interventions and therapeutic approaches used to manage these disorders and improve the well-being of older adults. End of Class 22.